Hello everyone, it's Kurt Cocker, the registered nurse from Cape Ann Botanicals and Cape Ann Cannabis here in the North Shore of Massachusetts. I want to talk about my own personal experience using cannabis as a post-op medication. I've had 15 orthopedic surgeries in my lifetime. I'm quite the biotic man. And just recently I had both my shoulders replaced, about 9 months apart. I had my left shoulder replaced in October of 2020. And I had my right shoulder replaced in June of 2021. I'm about 8 weeks out right now. And I used cannabis to manage my pain with amazing results. I'm going to give you a little bit of insight on how cannabis worked so well for me. One of the biggest things I can tell people that I found out from having all these surgeries is having the pre-op physical therapy appointment really helped me. So prior to surgery, when you go see your orthopedic and you decide you're going to have a surgery, I would make sure you ask him to see a physical therapist prior to your surgery. This is so they can get some measurements of your range of motion, give you some stretching and strengthening exercises for that particular joint that will help you with your outcome. Secondly, I will tell you as well that you want to find the cannabis product prior to surgery, typically an edible. And the reason why I want you to do this is to see if it's going to give you the effect that you're expecting, and also to check to see if there are any unwanted side effects prior to surgery. I found a 5 milligram gummy that seemed to work very well for me. It was a full spectrum product with CBD and THC together. This is called a 1-to-1, 5 milligrams CBD, 5 milligrams of THC. And I looked for a full spectrum CBD topical lotion or salve. I liked the lotion better that didn't have any mentholatum in it, just to let you know. And it really helped me get great pain relief and reduce some of the inflammation as well. I also took a CBDA tincture. This is a 35-to-1 tincture, 35 parts CBDA to 1 part. This is a raw form of CBD oil, and I use this in correlation with my cannabis as well. I did take a gummy around the clock, so every 4 to 6 hours I took a 5 milligram gummy, and sometimes taking a gummy and a half that would be 7.5 milligrams of THC and CBD together at nighttime to help facilitate sleep. I did reduce my dose about 1 week out to half a gummy every 4 hours, and a week later I only used the gummy as needed. I did ice regularly to help inflammation and reduce pain. And that if you are taking an opioid, I want you to get that opioid that the doctor prescribes and have that at the bedside. I had Vicodin at the bedside just in case the cannabis product did not help me, but I luckily did not have to use it. If you do use that opioid with your cannabis product, remember they can enhance each other. So watch out there. I did use a smokable product once in a while for breakthrough pain, but be careful. We could have problems with our lungs after surgery, and they usually give us this little plastic machine to take home. It's called an incentive spirometer. Kind of looks like a little plastic bong, and it helps you breathe in and open up your lungs. This is there to help incentivize us to open our lungs and help reduce any problems after surgery, get us back to normal. So please be careful if you use a smokable. Also, if you're prescribed a blood thinner, be careful there as well. I was prescribed a baby aspirin, which is only 81 milligrams of aspirin twice a day, and I avoided taking it with the cannabis and CBD products. I took them I took the CBD or cannabis 1 hour prior to my taking the aspirin or 1 hour after. One thing to remember, if you're using that cannabis product, you need to be careful getting up from a lying to sitting to standing position. Cannabis can cause us to get dizzy, and we don't want you to fall after having that surgery. If you have any questions, please reach out to me at the Cape Ann Botanicals and Cape Ann Cannabis websites. Remember to hydrate, be careful, and go low and slow. We'll hope to see you out at some of the cannabis or the CBD stores. Take care.